Senator Baldwin.
Thank you, Mr. Chairman. Welcome.
Thank you.
Congressman. You've already been asked about your investments in medical device companies, pharmaceutical companies, as part of the prior questioning. But for the record, have you also received campaign contributions over the years from political action committees associated with many of these same companies?
I don't know, but I assume so, just as many of us do.
Okay. So in terms of, I mean, what the American people want to know, of course, when you get reviewed for potential conflicts of interest and, you know, your procedures with the Office of Government Ethics, is that, that in your role, you're fighting for them and not biased towards the powerful companies that you've invested in and that have invested in you. And you've taken some questions on that, but just let me follow up a little bit to ask first, do you think drug price increases that we're seeing right now, for example, the six-fold increase in the cost of an EpiPen, is a problem right now for Americans?
Oh, as I mentioned, I think there are certain areas where drug pricing increases seem to have little basis in rational findings. I do think, however, as I mentioned again, I think I did, that it's important to appreciate that we've done some good things in the area of drug pricing, whether it's in the generic arena where the prices have been held down significantly, and the Part D area where prices are...
Since my time is limited, let me continue down this, this track. You've been asked already, but Trump supports Medicare drug negotiation. Will you work to repeal the prohibition on Medicare negotiating for better drug prices on behalf of the American people if confirmed for this position?
Well, I understand that if I'm confirmed and if I have the privilege of serving as secretary, that the boss that I have will be the President of the United States.
So will you work to repeal the prohibition on Medicare negotiating drug prices?
Following discussion and being informed by the individuals within the department and working with the President and then carrying out his wishes.
Was that a yes or was that a no?
It depends on that activity. I would hope
he
that...
He stated his position very recently, in fact, that he supports price negotiation so that people on Medicare can have the benefit of that. Is that something that you would press Congress to do? In other words, repeal the prohibition on that negotiation?
I think we need to find solutions to the challenges of folks gaining access to needed medication. And
okay.
It may be that one of those is changing the way that the negotiations occur. As you know, the negotiations right now occur for seniors with the PBMs, with the pharmacy benefit managers.
And you haven't said yes or no. Like, you just talked about transparency. Would you support drug price transparency, mandating that any drug company that wants to increase prices on their drugs release public information on how they set their prices, because so many of these appear to be without justification, as you just mentioned?
Yeah, I think there's a lot of merit in transparency in every area, and certainly in this area. And I'd look forward to exploring, if I'm confirmed with you, the ways to be able to make that work.
Thank you. So I wanted to go back to the first round of questioning with the chairman who showed a chart, and it seemed like what was implicit in the back and forth was that the act of repealing the Affordable Care Act would only impact perhaps a very small part of the healthcare industry. You talked about 6% being covered on the individual market. The protections, like coverage on your parents' health insurance till you're 26 and mandating that people be covered even if they have a pre-existing health condition, things like eliminating caps that led so many into medical bankruptcy, those apply across the healthcare system. So repeal in no way limits us to a conversation just about a small percentage of our population. This is about serious impacts for all of America. Would you agree?
I think that the discussion about what our health policy for financing and delivery of health care to the American people is a very, very broad subject, and we need to discuss.
If you repeal the Affordable Care Act, the impact is not narrowly confined to Medicaid and the individual market. It has impact on every American. And Medicare, too. Think of accountable care organizations where we're driving so much of our innovation. That's not confined to the individual market. In fact, it impacts Medicare very, very significantly. So let me give one example. We in our office, when you visited, and thank you for your visit, we talked about the opioid epidemic. One of the significant issues is access to treatment to overcome an addiction. If the Affordable Care Act is repealed, there will no longer be a mandate for substance abuse treatment being covered. Is that something you agree with?
Look, the opioid epidemic is rampant and is harming families and communities all across this nation.
Would you assure that treatment would be, substance abuse treatment would be covered under a replacement plan that you would propose?
I think it's absolutely vital that substance abuse and other kinds of things are able to be treated. So you would keep that
protection of the Affordable Care Act?
That's a legislative decision, but I look forward to working with you to make certain that we're ensuring that individuals are able to get the care they
coverage, need. I want to make sure I heard the exchange, because it sounded to me like you're saying you think insurers are just going to continue to do it, so that there's no need for there to be an actual mandate saying they must. And mind you, with 5.7 million young people between the ages of 18 and 26 on their parents' health insurance, that's 5.7 million people who aren't in the individual market because they're in their first job after high school that doesn't have health insurance, or in school without. Is it just a wink and a promise, or do you support having in law a mandate that 18 to 25-year-olds be able to stay on their parents' health insurance?
What I have, as I say, I think it's been baked into the insurance programs that are out there right now. What I absolutely am committed to. But they could change
their mind at any time.
What I'm absolutely committed to is making certain that every single American has access to the kind of coverage that they want and has the financial feasibility to be able to purchase that coverage.